Hello everyone, welcome back to our channel. It's always a pleasure to reconnect with our devoted viewers who remain dedicated to understanding and exploring the exciting world of mental health. Today we have another insightful session lined up for you, a session that promises to enrich your knowledge and deepen your understanding. As we all know, mental health forms a critical aspect of our overall well-being, sometimes even more imperative than physical health. It's an area that requires constant learning, unlearning, and relearning due to its dynamic nature. Today, we aim to delve deeper into one such essential topic: schizophrenia management. Schizophrenia, as you might already be aware, is a severe mental disorder that affects how a person thinks, feels, and behaves. This condition may seem as if the individual has lost touch with reality, which can be quite distressing for the person impacted and those around them. Posing immense challenges for those diagnosed with it, schizophrenia is a disorder that calls for extensive understanding and empathy. Throughout this session, we will be discussing the various aspects of managing schizophrenia, from understanding its signs and symptoms to the role of caregivers, and the importance of societal acceptance. Each aspect plays a crucial role in ensuring effective management of this disorder and providing the support that individuals with schizophrenia need. And one cannot talk about schizophrenia management without mentioning the significant role that antipsychotic medications play. Antipsychotic medications serve as the backbone of schizophrenia management, helping reduce the intensity of symptoms and enabling those affected to lead a relatively normal and fulfilling life. However, the use of these medications isn't without its challenges. Deciphering through the myriad of available options, understanding the side effects, and figuring out the right dosage requires professional expertise. Today, we will aim to demystify the same for you. We strongly believe that knowledge becomes more valuable when shared, and through today's session, we hope to impart some valuable insights that can help you, or someone you know, navigate the path to managing schizophrenia more effectively. Today, we're embarking on an enlightening journey into the realm of schizophrenia management and the role of antipsychotic medications. Antipsychotic medications serve as a cornerstone in the treatment of schizophrenia. This is a fact that is widely accepted in the field of psychiatry, a crucial piece of the therapeutic puzzle that helps patients reclaim their lives from the invasive and often debilitating symptoms of this disorder. The importance of these medications cannot be overstressed, for they offer a beacon of hope in a condition that was once considered untreatable. The world of antipsychotics is vast, and its complexities often surprise those who first venture into it. These drugs come in many different types and classes, each having its unique profile of effects and side effects, indications, and dosages. Among these, there are two main categories that clinicians and researchers often highlight: high-potency and low-potency antipsychotics. High-potency antipsychotics are a group of drugs that command attention due to their high efficacy. They're the heavy lifters in the antipsychotic world, often used when symptoms are severe and other treatments have failed. Drugs like fluphenazine and haloperidol fall into this category. They stand tall and strong, brandishing their high potency like a shield, wage war against the onslaught of schizophrenic symptoms. They promise a higher efficacy, a chance at a life less dominated by the fear and confusion that schizophrenia brings. However, this high efficacy comes with its own set of challenges. High-potency antipsychotics may present a higher risk of certain side effects. These include extrapyramidal symptoms, EPS, movement disorders that can range from mild tremors to severe Parkinsonian-like symptoms, and tardive dyskinesia, TD, a condition characterized by involuntary, repetitive body movements. The use of these medications is often a balancing act, a weighing of benefits against potential risks. On the other hand, we have the low-potency antipsychotics. These medications, such as chlorpromazine and thioridazine, are the gentler cousins of the high-potency variants. They may not pack the same punch in terms of efficacy, but they have their own advantages. They a lesser risk of EPS and TD, making them a safer choice for many patients. However, the road with low-potency antipsychotics isn't entirely smooth either. These drugs may induce more sedation, causing patients to feel drowsy or fatigued. They can also lead to cognitive issues, impacting areas such as memory, attention, and problem-solving skills. The choice to use these medications involves a careful assessment of a patient's overall health, lifestyle, and personal preferences. In conclusion, The treatment of schizophrenia involves a complex interplay of factors. It requires a deep understanding of the nature of the disorder, the specific needs and circumstances of the individual patient, and the therapeutic options available. Low-potency antipsychotics, such as chlorpromazine and thioridazine, carry a lesser risk of EPS and TD, but may induce more sedation and cognitive issues. An incredibly critical aspect of antipsychotic treatment that everyone must be aware of is the neuroleptic malignant syndrome, a potentially life-threatening complication. It is a serious condition that can arise due to antipsychotic treatment and is regarded with extreme caution in the medical field. This syndrome is not one to be taken lightly, as it can pose severe threats to human life if not detected and treated promptly. The main characteristics of this complication are far from subtle. It manifests itself in the form of severe muscle rigidity, a condition that can be utterly debilitating. This rigidity, the stiffening of muscles, can result in a person losing their mobility, leaving them in excruciating pain and discomfort. It's a distressing symptom that can escalate rapidly, affecting someone's quality of life dramatically and urgently, demanding medical attention. Moreover, within the array of symptoms, high fever is another stark indicator of neuroleptic malignant syndrome. This isn't just an ordinary increase in body temperature, it's a fever that soars high, resulting in an immense amount of discomfort. It can be alarmingly high, adding to the intensity of the syndrome and the urgency of the situation. This symptom, coupled with muscle rigidity, can lead to a substantial deterioration in the patient's health. Additionally, neuroleptic malignant syndrome dramatically affects one's mental status. It's not uncommon for patients suffering from this syndrome to display altered, even distorted states of consciousness. This can manifest as confusion, disorientation, or even hallucinations, further contributing to the distress and discomfort endured by the patient. In conclusion, the neuroleptic malignant syndrome, a critical aspect of antipsychotic treatment, is a potentially life-threatening complication. It showcases itself as severe muscle rigidity, high fever, and altered mental status. Understanding these symptoms and their implications is of vital importance in the early detection and effective treatment of this grave syndrome. In the world of antipsychotics, understanding serotonin-dopamine antagonism is key. Atypical antipsychotics, characterized by low EPS and efficacy for negative symptoms, exhibit stronger antagonism of 5-HT2 receptors than D2 dopamine receptors. Compared to conventional antipsychotics, atypical ones offer reduced risk of EPS, hyperprolactinemia, and cognitive enhancement, along with better efficacy in negative symptoms. There's an array of atypical antipsychotics from aripiprazole to ziprasidone, each with unique benefits and considerations. Extrapyramidal symptoms, EPS, can occur with antipsychotic use, and it's crucial to identify and manage these symptoms appropriately. Weight gain is a common concern with antipsychotics. While the exact mechanism is not fully understood, some individuals may experience metabolic syndrome, affecting overall health and medication compliance. Certain antipsychotics may also lead to cardiovascular issues and elevated prolactin levels, affecting sexual health and bone density. Regular monitoring and management are therefore vital. In conclusion, the management of schizophrenia and the use of antipsychotic medications is a complex yet fascinating topic. Treatment decisions should always involve a healthcare professional. If you found this video helpful, don't forget to show your support by liking, sharing, and subscribing. Stay tuned for more informative content.